Happy Wednesday Wellness, everybody.
Happy Wednesday. We're going to talk about chiropractic care and pregnancy.
Woo-hoo.
Congrats, you're pregnant.
Congrats, you're pregnant. We haven't talked about pregnancy in a little while.
No, we talk a lot about subluxation, a lot about stress, a lot about kiddos, and then sometimes we forget about the moms. But we love working with pregnant women.
It's so cool.
It's like we love it.
I mean, that has been kind of our bread and butter since the beginning.
Yep.
It's like that's our niche, that's our focus.
And we can help so much, help you have a better pregnancy.
Mm-hmm.
So,
even like pre-pregnancy planning. Like,
we have seen quite a few people for like that know they want to get pregnant. They're really educated.
Yeah.
They should be coming in.
Yeah.
But pregnancy, so you're pregnant, maybe you feel great. Awesome. Like, why would you see a chiropractor? Maybe you're having lots of aches and pains. It's common, sciatica, low back pain, ligament pain, pubic bone pain. I'd say even like more neck pain, tingling numbness in the hands.
Yeah. Headaches.
Swelling in the feet.
Heartburn.
Heartburn, yes.
How many symptoms can we name?
Yeah, I'd say those are all reasons why someone shows up here, but we also have plenty of people that do show up like, hey, I've heard this can help me have a better pregnancy labor delivery. Yeah. So we'll explain what we do.
Is, like, awesome.
That's awesome. Like, I love when someone shows up like, I feel great. I just want to be here because, but also like we can help you if you are in pain too.
Yeah, exactly. Okay. So, a lot of the symptoms come from the biomechanical changes of the body and stuff. Some of them are like hormonal changes and stuff too, which everything functions through the nervous system. Right. So helping the nervous system regulate can help with a lot of those symptoms just in general. And the way that we do that is obviously like through the adjustments and stuff too. We do the scans on our pregnant moms. There's no radiation. That way we can see how the brain and body are communicating, how much stress the body's under, and then we can come up with a plan kind of based on that too for the pregnancy. But one of the big things that we do is called Webster technique. So that is addressing really like the biomechanics of the pelvis.
Yeah, it's an analysis of the pelvis.
What's the pelvis doing? Yeah. Are we all lined up? Do we have a nice, beautiful, round opening here? Or are we a little offset? Yeah. Because that's going to change how the pelvis opening looks. It's going to change how the pelvic floor muscles are, like if they're tight, if they're stretched. It's going to change. I mean, our muscles are kind of going to let us know the most. Like if
muscles are going to spasm and try to stabilize the pelvis as the pelvis is misaligned.
Which is a lot of times why we get like sciatica and stuff like that too.
But it's important because here's our pelvis, but our uterus sits right in here, right? Uterus is where baby is housed.
Baby is growing right here.
Yep. And it's attached to the pelvis with the round ligament. So if pelvis is misaligned in any way, it can create tension on those round ligaments. But all that can create pain, right? Pelvis misaligned, low back pain, SI joint pain, sciatica, pubic bone pain, round ligament pain, all the things we talked about.
Baby sitting in a weird position. Now I have so much pain in my back and my back, like all that stuff. Yeah.
But also it can affect then how baby is positioned, as you were just talking. Like it doesn't have to mean breech baby. Yes, we can help align pelvis and hopefully get baby to move on its own, but also it's going to affect like how your labor and delivery is. If baby is not in good position for head to be hitting cervix, that's how you dilate. If they're coming down on an angle, it's going to make for a much longer labor delivery.
Yes, exactly.
So we're not moving baby around, but just by aligning pelvis, we're helping the psoas muscles, piriformis muscles, round ligaments, it really helps baby to get nice and centered in pelvis.
Yep.
And engaged where it should.
Yeah, it's just giving them like the optimal amount of space so that because babies innately know where to go, honestly.
Yes. Yeah. I mean, we did just have a mom in with breech baby. She was late in pregnancy, 36, 37 weeks. Oh my gosh, I just found out I'm planning a home birth, this and that. You know what? She had that home birth, that baby flip. But she was here. Like, she was here. She did the work. Like, should she have come in earlier? Yes. But we got things aligned and the baby was able to move, which is awesome. And like I said, she was able to have like the most beautiful, awesome home birth. Like I did a home visit afterwards and she was so happy.
That's so great.
And baby's so chill.
Yes. That's so good. Okay. So so it affects labor too.
Yes.
I mean,
labor.
Yeah. So I mean, not just only like baby's position in utero, how it's affecting like mom, the biomechanics, like all that stuff too. But how well they can get out then too, like you said. If they're coming in at an angle, it's going to delay a lot of like labor, probably like getting induced, we're not progressing, like that kind of.
Yeah, and more like opportunity for an intervention.
Yes,
like
exactly.
Whether that's, we're not progressing in labor, now C-section. Baby's stuck, we're not.
Baby shoulder stuck, we're going to use a vacuum or we're going to use forceps or
something like that. Yeah. And that, great, we want baby out, healthy baby, but that can create stress. That's a stressor on a baby that can create issues later.
Exactly. Yeah.
And we talk about birth trauma all the time.
Yep.
So we just want we love working with pregnant women because we want you to, one, have like the most comfortable pregnancy, but also have this hopefully labor delivery you're hoping for also.
And recovery afterwards is super important, because now you have to take care of a baby, and like you're also trying to heal from a birth,
right?
Which is really tough on a lot of moms.
Yeah, like if you labored for however many hours and that ends in C-section, that's recovering in multiple areas then.
Yep, exactly.
So I'd say we see a lot of women trying for a VBAC, and they usually have great success with it when they've like been under care for their second time around trying for a VBAC, which is awesome.
And are just like so much more comfortable through their pregnancies too. I hear that a lot. Like, it's awesome when we get first time moms. I love it so much, because that means they're like just really educating themselves and like
trying to do anything to have like the best birth.
Yeah, the best birth, the best recovery, like natural birth usually, but like the second and third time moms that are like, I haven't ever seen a chiropractor, I'm coming in because my first labor was so rough. And then when they are like talking to us each time, they're like, this is my favorite thing. I feel so good afterwards. My first pregnancy was atrocious.
Sleeping
this one
better.
is so much better. I'm sleeping better. I'm recovering better. I'm like, even having a toddler and being like a second or third round mom, it's just such a game changer.
But I do have a first time mom right now who's like, oh my gosh, I sleep the best on. I mean, she's 39 weeks pregnant now. She's like, I sleep so much better the day I come here.
Yeah.
She's like, so. Because we also, as we always talk about, calming the nervous system, which is also important for baby. Stressed out mom during pregnancy equals stressed out baby during pregnancy and after.
Yeah. And also, I mean, even if baby's in the best position, but you're really stressed out going into labor, that can stall your labor too.
Yeah.
Because you need to have a good parasympathetic, sympathetic balance to even go into labor.
Yeah.
Because so much of it is that oxytocin feedback loop too.
So if you're pregnant, it's never too late to start to come on in, but it's also start earlier. Like I said, even if you're not in pain, it's great to just have your body ready and feel great, and don't get to the point where you're like, oh my gosh, I'm in so much pain, I can barely walk. This and that. Yeah. It's harder to get you out of that.
It is, yeah.
It takes longer, those sort of things. So.
But yeah, the prevention is just like, it's easy then, Then you just feel great.
Yeah.
You have a great
really love being pregnant.
Yeah.
So yeah, message us, call us, text us.
Yep.
We're here.
We'd love to see you.
Yes. If you have questions, let us know also.
Yep.
Okay. Bye.
Bye.